Many women of this Gen Z generation suffer from this particular condition, but they insist on paying deaf ear to it. What are we talking about? PCOS. Now, this is a common condition that is actually common among women of reproductive age. This particular condition is caused by what? Hormonal imbalance, and as a result of that, it leads us to problem with what? Ovulation, infertility, and an increased level of what? Male hormone in the woman body. What particular hormone are we talking about? We are talking about the hormone androgen. Now, on today's video, we'll be discussing everything you should know as a lady about PCOS, how to know if you have PCOS as a lady, and the types of PCOS, because PCOS has types. You can't just say, I have PCOS. What type of PCOS do you have? And lastly, but not least, we'll be talking about the treatment. What should you do if you have PCOS? So if you are interested in everything I just mentioned, please stay to the end of this video. Let's discuss about that, okay? I'm trying to test my microphone. Microphone testing? Trick. Okay, perfect. You got this, okay? Stop this rubbish you're doing. Hi guys, welcome to my YouTube channel. My name is Nurs.Fay, and on today's video, we'll be talking about PCOS. Now, what's the full meaning of PCOS? PCOS simply stands for what? Polycystic ovarian syndrome. Now, this is a particular condition that is common among women of reproductive age. When I mean women of reproductive age, I mean like women within the childbearing age. Now, this particular condition is actually caused by what? Hormonal imbalance. When I talk about hormonal imbalance, I mean to say like the hormones in the woman reproductive system are not within the normal range. Let's say, for example, 6 to 7, and then the hormones are above 7. Now, there's a particular hormone that is actually the masterpiece, like the mastermind of all this thing, of that is behind this particular PCOS, and that particular hormone is called androgen. Now, polycystic ovarian syndrome. Let me explain what polycystic means. Polycystic means an underdeveloped follicle. Now, as a lady, you release a particular egg every single month. But in polycystic ovarian syndrome, there is an underdevelopment of a particular follicle. And as a result of that, because that follicle did not develop to the stage it should release a egg for fertilization, the follicle gets stuck and then appear as a patch in the ovary. As a result of that, as a woman, you don't know when you're ovulating. That's when you're releasing your egg. The cause of this particular thing is actually a particular hormone called androgen. Now, androgen is a particular hormone that is found in male, that is male. But in this scenario, this particular hormone tends to appear in female and in a large quantity. So as a result of that, this hormone tends to do what? It tends to reduce the development of this follicle. Like androgen does not allow this follicle to do what? To grow. As a result of that, this follicle gets what? Stuck. And as a result of that, you don't ovulate, like you don't release an egg. And then at the end of the day, this follicle appears as a patch in your ovary. Now, imagine when this is a continuous process. You keep on having patches in your ovaries, and that is what we mean by polycystic. Like polycystic, you see the patches all over your ovaries. If you go for an ultrasound and then you find out that you have a polycystic ovary, you are prone to like they will just diagnose that you have PCOS. But having an ovary that is not polycystic, a clear only ovary, doesn't mean that you don't have what? That you don't have PCOS. You can actually have an ovary that is what? That is clear. You don't have any underdeveloped follicle, you don't have any patches, and then you're still suffering from what? PCOS symptoms. This boils down and brings us down to the types of PCOS. There are four types of PCOS. We have one, adrenal PCOS. Two, we have insulin resistant PCOS. Thirdly, we have inflammatory PCOS. And last but not the least, pill induced PCOS. The first we're going to talk about is what? Adrenal PCOS. Now, adrenal PCOS is a type of PCOS that's actually being caused as a result of what? The adrenal gland producing excess androgen. That's this particular androgen that we've been mentioning all this while. When the adrenal gland produces excess androgen, this particular androgen does what? Tends to reduce the what? The growth of follicles in the ovaries, thereby causing these follicles not to do what? To release egg. And then it comes with symptoms like excess hair growth, acne, and lastly, irregular period. Now, secondly, we have insulin resistant PCOS. Insulin resistant PCOS is one of the most commonest type of PCOS among women. But this type of PCOS tends not to be what is not easily known. Like you cannot easily detect it like the adrenal PCOS where you see patches in the ovaries, you see a polycystic ovary. But in insulin resistant PCOS, there is no what you can't actually detect if a person is having it. That's why you need to go and do what run some tests. Now, what happens in insulin resistant PCOS? In insulin resistant PCOS, the body tends to do what? Resist insulin. That's the insulin that is supposed to break down food that you eat, that is to glucose. The insulin does not does its work. Thereby, there's excess amount of insulin, that is insulin in the bloodstream. Now, this excess insulin that is in the bloodstream tends to do what? Tends to increase the production of androgen in the ovaries. And as a result of that, leads to what? PCOS. And this particular type of PCOS comes with symptoms like excess hair loss, irregular period, and then acne. In that case, insulin resistant PCOS and adrenal PCOS both comes with acne as a symptom, but in insulin resistant PCOS we have what? Weight gain. While in adrenal PCOS we have excess hair growth in it. So this is a clear difference between insulin resistant PCOS and what? Adrenal PCOS. Now let's talk about the third type of PCOS, which is what? Inflammatory PCOS. Now in inflammatory PCOS, there's an inflammatory process in the body. There's an inflammation in the body, and as a result of that, this leads us to what? Insulin resistance, as the body resisting insulin, thereby bringing in thereby leaving a large amount quantity of insulin in the bloodstream, which results towards production of excess androgen by the what? Ovaries. So this inflammatory PCOS is almost similar to insulin resistant PCOS. As a result of that, both of them have similar symptoms, which is what? Weight gain, hair loss, and lastly, acne. So, the fourth type of PCOS we're going to talk about is pill-induced PCOS. Now, pill-induced PCOS, this is a type of PCOS that occur in women that take what? Birth control pill. Now, birth control pill is being taken in order to regulate what? The menstrual cycle. But when a woman stops taking this particular birth control pill, the menstrual cycle actually takes some period of time to do what? Adjust. And as a result of that, lead to the formation of cysts in the ovaries. So this is all about pill-induced PCOS. And this pill-induced PCOS comes with symptoms like irregular period, acne, hair loss. How do I know as a lady if I have PCOS? Now, as a lady, you need to watch out for these 5 symptoms. First, you need to watch out for what? Irregular period. If you're having irregular period, then you need to go and do what? Get some medical checkup. Second symptom you should be looking out for is what? Weight gain. All of a sudden you start gaining weight. You need to ask yourself, why am I gaining weight? The third symptom you should be watching out for what? Excess hair growth. As a lady, all of a sudden you start having excess hair in your legs, your arms, and then you're wondering is it's not normal. Come on, you need to go and run some tests and get, you need to ask yourself, why am I having this excess hair growth? And then all of a sudden, the fourth symptom you should be watching out is what? Hair loss. Why are you losing your hair? This is actually what? A symptom you should also be watching out for. Lastly, the fifth symptoms is actually what most women tend to do what? Misplace their what? Their priority. When you're having acne, which is the last symptom, most women tend to think like whenever they're having acne, it's facials, they go for their facials and all that, so you keep going for spa and all that stuff. Treatment, e no go work, it won't work. You need to ask yourself, why am I having excess acne? Like you need to run some tests, know why these symptoms are actually there. Some acne are just normal acne, yeah. Facial acne as a result of excess oil production in the face, but some acne you need to do what? You need to ask yourself a question again. Why am I having this acne? So aside these 5 symptoms, there's what we call the Rotterdam's criteria. Now the Rotterdam's criteria has 3 symptoms in it, like it has 3 criteria that and it's being said that once you have 2 out of this criteria, out of these 3 criteria, that you are being diagnosed of what? PCOS. Now, first in the criteria we have what? Irregular period. Second, we have excess androgen production. And thirdly, we have polycystic ovaries. Whenever you have 2 symptoms out of these 3 that has been mentioned, you are being diagnosed of what? PCOS. Now, what should I do if I have PCOS? Come on, guys. This video is actually for what? Enlightenment, to enlighten you what PCOS is all about. So I'm not going to give you the treatment or tell you that there's a particular drug for it. So, but there are things you need to do when once you actually like you've suspected, or from so far we've discussed, you know you've suspected probably that you're having PCOS. The first thing you need to do what is to go for medical checkup. That's number one. Number two, you need to run some tests, that is blood tests. You need to know the level of the hormones in your body as a woman. Thirdly, if you suspect any of these, probably acne, excess hair loss, all of these symptoms that you can actually examine by yourself, then you need to do what? Go to the hospital, get a consultation with a healthcare professional, and then book for the best treatment method and medications to take. If you decide to pay deaf ear to these symptoms which we've just discussed, or probably after watching this video, because this video is basically meant for enlightenment, and then you decide not to go for medical checkup and know probably meet your healthcare professionals to know the best course of treatment to procure, then you probably will be suffering from infertility in the future, diabetes in particular, type 2, or probably cardiovascular diseases, depression and anxiety. So please, don't pay deaf ear to this video. Don't pay deaf ear to the symptoms you're already having, okay? Go for medical checkup. So this is where we come to the end of this video. Please like, share, and subscribe. Hit that bell for notification as to know when we are dropping our next video. Bye!